Hello, namaste. Good afternoon. This is Ira Sahai back again after, I think a long time to record a course review video for D-Life Diploma, Low-Carb Nutrition and Metabolic Health. And my guest for today, or the certified doctor that I have with me today is Dr. Aparna Sanasam from Thobul, Manipur, and a bit of information on she's an MBBS and she has completed her MBBS and is currently working as a duty medical officer at American Oncology Institute AOI Impal. Beyond her professional journey, she's also a cancer survivor, which makes it so inspiring and relevant for everybody to hear what she has to say about the course, um, which has given me a unique perspective on the importance of lifestyle and nutrition and holistic health. Her personal experience deepened her interest in lifestyle medicine, particularly in the role of low carbohydrate nutrition for preventing and managing chronic diseases. This is a doctor saying this. So we will wait to hear from her, but a little bit more. To enhance her knowledge, Dr. Aparna pursued and successfully completed the D-Life Low Carb Nutrition and Metabolic Health Diploma. With this training, she aims to integrate evidence-based nutrition into her clinical practice, guide patients in improving their metabolic health, and inspire others through both her medical expertise and her personal healing journey as a cancer survivor. First up, Aparna, many congratulations. You're so inspiring that you've been a cancer survivor. You are an MBBS doctor, and yet, you had that spirit of scientific inquiry alive in you to probe much deeper and get into the root cause, or probably also how to improve your condition as a cancer survivor and holistic health through low carb nutrition. So welcome to this podcast, and we'll talk about your story now.
Thank you, ma'am. Thank you very much for this opportunity. I sincerely thank D-Life for giving me this
Yeah.
opportunity.
So, as I said, Dr. Aparna is an MBBS. She's based out of Impal. She's a practicing doctor and she has now completed the D-Life Diploma course. And she has integrated that learning into her clinical practice, as now seeing patients and also giving them LCHF D-Life protocol dietary advice and seeing fantastic results, from those interventions. But just to begin, with your story, Aparna, can you take us down in time when you were diagnosed with cancer, and what was this journey like?
Ma'am, it was really painful, I would say. I was preparing for my PG examination, and suddenly one day I was diagnosed with cancer. It was so sudden, and actually I was devastated. Everything stopped at the moment. And sab chhod ke I came to Mumbai for treatment. And as a medical professional, the increasing trend of cancer, the metabolic related diseases, has been increasing rapidly. And being a survivor myself, I realized that uh, the powerful role that lifestyle modification and nutrition that plays both in prevention and recovery. So this has inspired me so much to study nutrition in such a structured way, I would say.
And which year was this, Aparna? In which year were you diagnosed with cancer?
I was diagnosed in 2022 October.
And what was the cancer that you were diagnosed with?
It was breast cancer, and very sad to say for me also, it was a very late stage, I think. The metastasis, when the PET scan result was out, it has already metastasized to ribs. But it was, I would say, I don't know, it was lucky for me that it was only one single rib. And after aggressive treatment, radiation, chemotherapy, and surgery, my last 2, 3 PET scans are all cleared. And during my radiation therapy treatment, I have included this keto diet in my life and my own journey.
This
That
is
helped me a lot.
fantastic and so much learning. And we always say this that for mental health and for cancers, this is the best protocol. I mean, you must have watched Dr. Seyfried's, MHC Metabolic Health Conference session in which he talks about nutritional ketosis. And coming from a doctor, this is such a big validation, Aparna. Please tell us, how did it help you? Because at what stage did you adapt the, nutritional ketosis, and especially the D-Life protocol? Because you were in the community, you were learning from the forum, you were doing the course itself. So please take us through that journey. At what stage did you change your diet?
Previously, I didn't know much about this low carb diet and ketosis. And once during my radiation therapy treatment, one of my relatives suggested that there is something low carb and keto diet that can be added in your treatment. So I searched online and I met Dr. Janathan from Mumbai, and he guided me during that treatment about the low carb nutrition, how to adjust, how to do intermittent fasting for the first few days. Actually, we have eaten the not 3, 4, but 4, 5 times a day, small meals. And so adapting to intermittent fasting was not easy in the beginning itself. And after adjusting to intermittent fasting and low carb diet, I started monitoring my blood sugar, then ketone levels, and try to maintain DKI to around 2, 3 in cystic
Yeah, I
ketosis
think
repair.
you also,
Yeah.
yeah, that's fantastic, Aparna. I think you recently I handled a glioblastoma case, and we were aiming for GKI 1 to 1.3, and fantastic. I'm very happy to share with you that in the two subsequent we started in January 2025, and the first MRI was done in March, and the second was done in August. I will be posting that on Twitter. And in both, in the first, the overall size of the tumor has shrunk by 30%, and
Wow.
subsequent shrinking of the tumor in the August MRI has also happened. And we tried to maintain, GKI of 1 to 1.3. Fantastic to know this, and that you aim for GKI. This is the way, forward. So, Aparna, tell us, what kind of, you are in the oncology department. What kind of patients do you see? Of course, there are all cancer patients, and but what is the trend, and how do you associate it with the dietary habits of these people? Have you done some studies? Some data has been collected about it?
Not official data has been collected till now, ma'am, but as I have seen for the last 1 year, the patients that are coming here, actually the trend has shifted from all ages. Actually, people above 50, we used to see cancer patients, breast cancer patients, cervical cancer patients above 40, 50, but now the trend has changed. Cancer patients we diagnose in even 24-year-old. I was 29 when I was diagnosed, very young. And so in healthy, I mean, those who are newly diagnosed or who are active by themselves, so they can incorporate this dietary procedure. I mean, keto diet, low carb, or intermittent fasting, or hyperbaric oxygen therapy, they can be included. But in very sick patients, chemotherapy induced sepsis patients, like radiation, those weak patients we can't include. So we have to do the normal diet plan. So in my experience, I think we should add one separate clinic to each cancer hospital for this low carb. Actually, our hospital doesn't have that kind of facility till now. I myself just uh, finished the course, and I just personally added this knowledge to other patients
Yeah,
about I have this
Aparna,
team of this.
Dr. Aparna was just telling me when I asked her, is she handling patients also on the dietary spectrum? And she said, yes, she's doing that. And she's seeing stunning results. I mean, being a doctor, when you apply the nutritional protocol, or TCR as we call it, therapeutic carbohydrate reduction, and especially 100-gram carbs per day for people, especially who are vegetarians, Indians, by and large. So, Aparna has started this consultation alongside, where she wants to help people regain their metabolic health and optimize their metabolic markers and blood markers, and, live a very healthy life. But now please talk about how you are implementing the knowledge from the life. Um, And what kind of patients are you seeing? What is the outcome? What is the time taken to, turn around these people? What are the markers that are improving and in how much time?
Actually, ma'am, I would say my first patient was not cancer patient. It was my aunt. Actually, she was diagnosed with diabetes, newly diagnosed, and without giving a single medicine, by just diet change and lifestyle modifications, exercises, she reversed in 2 months. Her
2 months. And
HbA1c
what
was
was the
normal.
A1C? Aparna, what was
HbA1c
the A?
HbA1c was like in the initial diagnosis, it was like 6.5 something, and fasting was 170 plus, and PP was 240 something. I
Oh,
actually forgot the number. It was very, and it was the first time I was the first time to take her in the as a family doctor, and I said, don't take medicine for now. Let's try something new, and she
fantastic.
was
And this is
reversed.
coming from a doctor. This is coming from a doctor who is an MBBS. And when it came to her own family members' health, what did she tell them? To, try the LCHF diet, try the low carb, high fat diet. And that has given her fantastic results. Do you think, Aparna, if she had been on pills, you would have seen the same outcomes?
Maybe in my control, but I don't think so.
Yeah. So, of course, I mean, pills, there is an alternate way of improving your metabolic health. And in 100 out of 100, I would say, maybe giving the benefit of the doubt to 1%, 99% of times, maybe more, we have seen a complete reversal of diabetes. I'm using the word reversal because, as Anup
Yeah, yeah.
says, unless somebody can give me the signs of 60 to 70% carbohydrate on the plate, I will call it reversal. So,
Mm.
fantastic, Aparna. And now coming back to the course, why did you choose?
Fair enough.
Yeah. So I was on the question, Aparna, why did you decide to join D-Life, being a doctor yourself, being a cancer survivor, you're working in the oncology department. Why did you feel it necessary to, come and do the D-Life diploma course?
Ma'am, as the medical professional, I have seen how this lifestyle and nutrition related diseases like cancer, diabetes, PCOS, obesity, and other metabolic health syndromes that are increasing so rapidly. And being a cancer survivor myself, I realize how powerful the role it plays, the nutrition and lifestyle management in both prevention and recovery. And this inspires me to study nutrition in a more structured way.
Yeah. Can you hear me, Aparna?
Yes, ma'am, I
Are
can
we
hear you.
connected? Yeah, you were saying something.
Okay, ma'am.
You were saying something about the course. Yeah.
Yeah. As a medical professional, I have seen how lifestyle and nutrition related diseases like PCOS, obesity, then diabetes, cancer, and other metabolic related diseases are increasing so rapidly. And as a cancer survivor myself, I realized that the powerful role that lifestyle modification and nutrition uh, can do in both prevention and recovery. And this inspired me to study nutrition in a more structural way, and this in this D Life has done a fantastic job.
Yeah. So being a doctor, I think many doctors are now realizing, and we've already seen the metabolic health conference where doctors are now using TCR and nutritional ketosis, for every chronic disease and even cancers and mental health and all of that. So Aparna, tell us about the course. What did you like? Because you are a doctor and you have studied the the medical curriculum, and now for doctors to enroll in the D-Life diploma course, they will not enroll in just any other course. So tell us the difference when you came to D-Life. How did you like the course? What was the USP of the course? Because I've seen your review and you've given a fantastic review about the course, that it's a must for doctors. So talk a bit about that. How was the course itself, the experience of going through that?
Actually, MBBS doctors and MDMS, I would say. Actually, we are blindsided in this nutrition area. Actually, we don't know much. There is some dietitian related separate area, so we don't go there, and we just prescribe medicines, clinically diagnose and treat the patients. But this nutrition area, we are so blank, actually. And after my own journey, I realized that this is so important, that it helps in prevention during treatment and recovery. So, and the D life, in D life, the depth of the scientific content and the practical applications of the concepts. This is very great. And it doesn't just cover theories, it provided the real case discussions, the case management, how to strategize the patient management, and and there is also the comprehensive, I would say, scientific references, articles, case studies available in the library section. So it's really, really helpful.
Yeah, I think new case studies, they keep coming up in the community every day, and new researches, new studies, new data, new evidence is posted every day. So if one were to, as Dr. Pat Samal said, it is like the Bible of low carb nutrition, and I have it open on my desktop all the time. And any chapter that I want to deep dive in and refresh, and you have so much of course material attached to that. Every chapter that the learning never stops. I mean, it'll take you probably a month to complete the entire chapter. If you're very fast, then probably 15 days, because there are so many studies, the latest evidence, everything, given in that chapter besides the main chapter itself. Um, Wonderful to know that, Aparna. Also talk about the community, the D-Life community. We are a very vibrant group. We are a crazy group of people who are going out and, reversing things and probably shocking doctors. But you are a doctor who's in the family, so probably we can talk in a more fun way about it. So I know that something that doctors were supposed to do, and moreover, it's not their fault. It's the education that they have received that's not reversing anything. So as a community, we work together. Doctors, T-Life trained doctors, our consultants. There is literally everybody there from the healthcare industry. We call it healthcare because we take people off pills, and even our doctors, we are so proud of them because they are also, interested in remission rather than giving pills. Talk about the community that we are, the WhatsApp group, the forum, the recipes, and the discussions that we have.
I would say it's the quorum is excellent. The mentors, the instructors, they are always approachable, and the community itself is very, very active and very encouraging.
Yeah. And how is the support? I mean, I don't think there is any other course in the world, Aparna, which would give you, so much support in terms of recipes. So it's not just something that's just theory. You are given step by step, hand holding. Nobody gives
Yeah.
2000 recipes. Nobody gives forum discussions and, cases, hand holding guidance, free to, complimentary to all its enrollees. Once you just pay for the certification, you get that and you are out. So I think D-Life has created a very, very close-knit and powerful community of people who are going out there and making a difference on the ground. What do you feel about this? The recipes, have you tried any of them?
Yes, ma'am. I have tried so many. Actually, in the beginning, I don't know how to this one prepared Indian meals properly. Actually, the diet in the Northeast and the mainland Indian is थोड़ा
Correct.
different है.
डिफरेंट
So
है, थोड़ा डिफरेंट है,
I
बट कैसे इंग्रेडिएंट्स को यूज करते हैं ये बहुत इंटरेस्टिंग है. एंड
uh,
आई थिंक यू विल फाइंड द रेलेवेंस बिकॉज ingredients after all are the same. The taste is different, it's culturally made a bit differently,
yeah,
but
yeah, yeah.
use of ingredients and the low carb ingredients that can be used, I think that's mind boggling.
Yeah, we have this paneer hai, we have desi ghee hai. These are very, very powerful.
Good. Correct. So, Aparna, is a last question, which is very, very important, relevant, and will make a lot of, will carries a lot of weightage from somebody who's a doctor herself
Mhm.
and who is a cancer survivor, who has seen the medicine side of things and also seen the magic of nutritional ketosis and studied the D-Life 100-gram carbs protocol, which is especially for Indians. I mean, we have enrollees from 21 countries, but that the fact that it addresses even Indian vegetarians, it's a very big thing. So, Aparna, what would you actually tell us about the D-Life course?
I'm pardon. There is some.
Yeah, can you hear me now?
Yeah, ma'am.
So my question is, being a doctor, what would your advice be to people who are healthcare providers, especially doctors? Why must they do this course? And the definite difference it makes in the patient outcome at the end of the day.
Actually, ma'am, I would definitely encourage to every healthcare practitioner, because it doesn't just add to our knowledge. It changes the way we think about the patient care and the lifestyle management. For me, it has been both a professional milestone as well as a personal journey of growth. So I believe it can be the source for others also. Same.
Yeah. So doctors should study nutrition, and as everybody knows, I mean, I think that's one reason why also Aparna joined eLife in India. We
Yeah.
are, of course, approved under the Government of India, Ministry of Skill Development and Entrepreneurship with NSDC partner. There is no other course. And in the world, we are the largest course in terms of CPD accreditation, which is recognized in 50 plus countries. And we have the largest, globally largest, biggest CPD hours of 144. That's mind boggling because nobody's even close. Nobody's even half of what we are. So makes sense, to do D-Life course. And in terms of the fee, I think we cost one fourth of what the second biggest course costs. So this is absolute value for money. Before we go, I will ask Aparna to share her, phone number or whatever she gives out. But before that, a bit on the D-Life course itself. We are the largest content on low carb nutrition and metabolic health with 1,000 plus references in the course, to 50,000 plus words, 100 plus relevant videos is there to the course. I mean, we don't, there is no recertification clause. The course access is always there with you, as I said. There is 6 months additional access to the forum from start of internship. There is no recertification clause now to a certification. I think inspired by us now, a lot of other, smaller certificate courses, who are not in this space, but otherwise as well. They have changed their policies and they have, done away with the recertification clause. Good change. And we are the legally attainable course in India, as I said. And we are the CPDSO UK accredited with the global biggest 144 CPD hours. And CPD certificate is recognized in 50 plus countries. So all our practitioners with CPD certificate are practicing internationally, and location, time, space is not a limit. So we are also the SMHP approved CMHE provider. There are 3,000 plus combined success stories on the forum itself. I would say 250 documented and 15,000 plus created every year through our 190 plus certified consultants. Huge, huge data there, which we call randomized community trial. So this is given free. This forum data is given free when somebody enrolls into the course. So I'm talking about the forum. This is what the forum has. Then the forum has 2,000 plus low carb keto recipes, original recipes that are posted by the members, 50% of which are vegetarian. There are 100 plus podcasts. We have the largest content on low carb nutrition and also resources in the world. So we are the biggest platform. One of the biggest libraries of low carb resource material, as Aparna said, and we have a 24/7 WhatsApp community support, mentoring, bonding, learning, and fun, of which Aparna and I both are a part, and very proud that we have doctors like Dr. Aparna, who are so young, who are out there to make a change. She's a cancer survivor, she's an MBBS, and she put herself on the nutritional ketosis protocol and saw marked difference. Now she's using low carb D-Life protocol on her patients and getting better patient outcomes. I think Aparna, you can start a clinic because I think Manipur needs you a lot, because what you're doing, what you've done with yourself, with your family members, with your patients now, needs to reach masses. So I do think that besides being a doctor, it is a larger onus and responsibility for you. Prevention, guidance, and if they have, diabetes, as you said in your family, reversal through low carb dietary intervention, the light of D life must spread through you. So, Aparna, if somebody is in around your place and wants to reach out to you, even otherwise she's practicing globally. So if somebody wants to reach out to her, how can they reach out to you?
I have my Facebook page and my name Aparna Sanasam, and in Instagram account, and also I'm in Twitter.
Yes. So if you want to give out your email ID or phone number or something like that,
Yes, ma'am, that's fine.
you please give.
My contact number is 894. Sorry, I will change another one. One second, ma'am.
Yeah, no problem. So if you're around Parna, she's in Manipur, Impal. If you're around that place, you want to physically meet her, take her consultation, you can get on, or any of these contact details and reach out to her. She's a practicing doctor. She works in the oncology department in Impal, doing major groundbreaking work because she is now implementing the D-Life dietary protocol and seeing fantastic results. So if you have diabetes, if you have any of these metabolic syndromes, please reach out to her. You may be anywhere in India, you may be overseas, you can still reach out to her and take her help. So, Aparna, yes, you want to give out your phone number?
Ma'am, it's 892-882 4364. And my mail is aparnasanasam@gmail.com.
Great. So all you people note down her number and you can get in touch with her if you wish to. She's D-Life certified. She's an MBBS. She's a practicing doctor and she has done wonders, coming out of, the trauma and won over cancer. I would say she's a cancer survivor. I don't like to use the word. I think she's a cancer winner. She's so victorious. She's come out. She's taken the lead in guiding people and now she's focusing on prevention and using D-Life dietary intervention. Any last words there, Aparna, before we wind up?
Thank you, D-Life. I sincerely thank you for giving me this opportunity. And for anyone who wished to join, I would say just go for it. It is one of the biggest investment one can make in your own
There's nothing
career.
bigger than
Thank
your
you.
there's nothing
Yeah.
bigger than your help, and coming from a doctor, you should take this as the last word. And I always say, D-Life train mainstream doctors. So this is the community that we are proud of. They are family, they are D-Life family. Very, very proud of the work that Aparna is doing, and will always be proud of. Maybe in the next metabolic health conference, will feature Dr. Aparna Sanasam because not only she's an MBBS, but she's a cancer winner, and now she's guiding so many people with the D-Life protocol. Hats off, Aparna. Lovely to be talking to you, and lots more interaction going to be happening in the WhatsApp community, in the forum. Family for life. Thank you so much for coming. This is Ira Sahai signing off. I'll be back again with another D Live Diploma course review video. Till then, take care. Bye bye.
Bye, ma'am. Thank you.
Thank you.